Hello, friends. This is Dr. Sweta Adatia. I'm a neurologist and I work at Rock Hospital in UAE. So, Alzheimer's dementia. Today is World's Alzheimer's Day, and I had to give you this message about keeping your brain healthy. So, let's see, are you the one who needs to be worried that you have Alzheimer's? Quickly, what are the five signs that you need to be monitoring to avoid getting a late diagnosis of Alzheimer's? By the way, Alzheimer's happens much later in the age, about 60, but we do see some younger patients also suffering from Alzheimer's. The first and foremost is a significant memory dysfunction. When you start losing things, when you cannot find the stuff that you have kept, that's number one. Number two is when you lose orientation. Let's say you're driving and suddenly you forget where you are going. This is a very, very important sign. Number three is when you start to have behavioral issues, when your mood is low, when you cannot interact with people, there is a point of anxiety or other mood disturbances. It's the time when you need to see the clinician. And the fourth and very important point is about the lack of insight. So most people with Alzheimer's dementia do not have an insight into their problems, while if you have other memory issues, you're very well aware, you know, this is my problem, etc. So the caregivers of Alzheimer's have to be aware about this particular symptom. And very, very important is sometimes the Alzheimer's dementia may present not really with any of the above, but just simply as apathy or listlessness, which means you're not, active, or you've lost that fervor or vigor for life. So all these are the signs which have to be kept in mind for Alzheimer's. Now, brain is an essentially amazing organ. I always say that I have romance with the brain, and brain is something which is absolutely marvelously structured and engineered. We do remember childhood stuff, right? I mean, I still remember the fresh smell of the cooking from my house, from my mom's, wonderful cooking. I mean, still till date, about 40 years alone, long, also you remember. So your memory is stored in multiple facets, it's blocks which are in your brain. You retrieve it when you need it. Short term, for example, if I ask you a digit, a five number or a 7-digit number or a phone number, immediately your brain stores it as a short-term memory. So memory is of various types, and essentially what is happening with the Alzheimer's dementia is that you lose the short-term conversational memory. You forget things which are just happening. Very, very, very long memory may still be preserved because it's all stacked there, etc. But nowadays, memory is definitely a concern. There's too much of stimulation around, and even young people come to me and say, Doc, can you check for me for Alzheimer's disease? So, what do we do? So, we do detailed assessments, we check inside the brain, structural part of the brain. We do evaluations to understand whether you have dementia or not. Now, the beauty of the thing is, I'm very excited today to actually formally not be scared to give a diagnosis of Alzheimer's, because we know modern science progress and we have solutions such as aducanumab, etc., which are antibodies which remove the toxin of the Alzheimer's. Today, as we speak, it's available right here with us, but the prerequisite is we need to diagnose it properly. You, as a patient, or you, as a person who is worried about the memory, should not take it lightly. You should straight away visit a doctor who can help you out to determine it. And by the way, a lot of people come to me and say, hey, doc, how do we have normal memory? How do we boost our memories? What are the memory hacks and tips and tricks? Basically, my only one trip, I would say a trick would be use it or lose it. You want all the areas in the brain to talk to each other, constantly remain stimulated. You want them to be working hard for you. All the neurons, the brain cells that fire together, remember this please, that fire together, wire together. And you want more of the wiring to prevent you from having this deadly, absolutely miserable condition called Alzheimer's dementia. So my message to you is keep actively engaged, go through new areas and routes, explore new things which are beyond your boundaries, read something which you don't have not dwell in. For example, I'm a doctor, but I have never had a chance to deal with finance. So if I read my finance, my brain has to be stimulated. That's wonderful for me. Try some new cuisines, try some sensory experiences, going around to new places, cultures, discoveries, etc. All these seemingly menial menial tasks are actually helping your brain. And by the way, there are also some tasks such as neurobics. Maybe sometimes later we will talk about neurobics as well, which is nothing but essentially making your brain work hard. How you have aerobics for your physical body, you do have neurobics for your brain. So I wish you all completely free world from Alzheimer's disease. I don't want any single person to have this absolutely dismal problem of memory dysfunction. I personally had COVID, and during that time, I had this taste of cognitive fog or memory fog or confusion for a short time. And believe me or not, that was painful. I mean, obviously, I recovered from that, but I am now empathetic to the people who feel memory is an issue and concern. Please get yourself examined. It's very easy and simple. Just come to us or any of the doctors and rule it out, because you don't want to wait until the last moment to be treated. So my message for you today, on the World Alzheimer's Day, let's have no Alzheimer's whatsoever, and please use it or lose it. Again, thank you very much for this patient hearing. I'm Dr. Sweta Adatia. I'm a neurologist, and I wish you the best brain ever from me.